Hi, my name is Dr. Charlie Cage. I'm a general dentist and welcome to my channel where I talk about everything dentistry. I know, right? You didn't go to dental school to be a photographer. Well, guess what? Photography is very important in dentistry. And today we're going to mention the different types of shots which I've found to be proven in helping me in my dental career. So why is it so important to take photos? Besides documentation, which can be helpful for legal reasons, well, it can be very helpful with treatment planning. It can also help improve your dentistry by being the most painful and helpful way to judge your dentistry. There's nothing like seeing your work with your naked eyes, and I have astigmatism. But imagine seeing it at 2.5 times magnification, or 5 times magnification, or blown up on a screen. Boy. In this video, I will stick to the types of shots that I take for a new patient exam, which is helpful in the treatment planning process. I will have a video coming up on the different types of gear, which is helpful, and also techniques. So let's start with the intraoral photos. The first shot that I take is the frontal or buccal shot. I have the lips retracted, so I'm able to see the gingiva and the teeth, and I'm able to analyze the gingival margin, the papilla height, the width to length ratio. It works really well for cosmetic cases. The next shot is the same view, except for I have the patient slightly open, just to the point where the anterior teeth on the maxilla is no longer overlapping the mandibular teeth. That way I can properly analyze the incisal edges of the maxillary teeth, especially if I'm going to change the aesthetics. Next are the buccal shots. It's a great way to see the buccal surfaces of the posterior teeth and also look at the relationship of the anterior teeth in regards to overjet and overbite. So those are 2 shots, one on the left, one on the right. The next 2 shots are occlusal shots, one of the maxilla and one of the mandible. It's a great way to look at the occlusal surfaces and also on the maxilla be able to visualize the palate. So let's go outside of the mouth. And I know for some people it might feel awkward to tell your patient that you're going to take a picture of a face. But how are you supposed to design a smile or treatment plan a patient if you do not see the face? The question is, can you design a smile without a face? It's like going shopping for decor pieces before I've moved into a new place. Oftentimes I end up buying a lot of unnecessary things and items that just does not fit the feel of the place. In order to accomplish facially generated treatment planning, you need photos of the face that the smile can fit into. It's not just on an articulator. So the first shot, I have the patient go into repose. And that's where I'll ask them to say Emma and not put their lips together. So Emma. That will show me tooth display. The next shot is just a normal smile, followed by an exaggerated smile. So I usually try to tell a joke. But unfortunately for me, I'm horrible at telling jokes because I'm too busy laughing for me to actually tell the joke. It's very important to get your patient into that exaggerated smile to determine the lip mobility and to determine if your patient does have a high smile line, which in aesthetic cases can be a challenge. And the last shot that I take is a profile shot, where I can analyze the patient's FMA, nasolabial angle, and also determine if they have maxillary and mandibular excess or deficiency. I know this seems like a lot, but trust me, there are a lot more different types of shots that you can take. But for me, I find these 10 shots to be beneficial with my treatment planning process. If this video was helpful to you, be sure to leave a like. And if there's a question that I didn't address in this video, be sure to leave a comment below. Let's talk. And be sure to subscribe. I plan to make a lot more of these. Bye.